Good morning. As many of you know, I'm Tina Anderson, founder of True Medicine, and I am currently studying to become an acupuncturist and an Oriental Medicine practitioner. And one of the things that has been so fascinating to me during the season of study is realizing how much traditional Chinese medicine has expanded the way I look at the human body. The deeper I go into this medicine, the more I understand why I have always been drawn to the idea of true medicine. True medicine, to me, is not simply asking, what disease does this person have? It's asking, why is this happening in this particular person? And traditional Chinese medicine has a beautiful concept that describes this perfectly. It is called Biao. Ben is the root and Bao is the branch. And once you understand that concept, you begin looking at symptoms very differently. So think about a tree. Imagine that you walk outside and notice that the leaves on a tree are turning yellow and beginning to fall off. You could focus entirely on the leaves. You could spray them, you could trim them, you could plant them you could paint them green if you wanted to make the tree look healthier for a little while. But eventually, you would have to ask, what is happening at the root? Is the tree getting enough water? Is the soil depleted? Are the roots damaged? Is there something interfering with its ability to absorb nutrients? Because the leaves are not actually the problem. The leaves may simply be showing up that there is a deeper problem. That is Ben and Bao. The branch is what we see. The root is what is contributing to what we see. And this is one of the concepts that has caused my perspective on health and illness to shift even further as I study Oriental medicine. We have been trained to name diseases, word curses actually. In Western medicine, diagnosis often revolves around giving a condition a name. And there is tremendous value in that, but modern medicine has extraordinary diagnostic tools that we can look inside the body. We can perform blood tests, we can identify infections, we can detect tumors, we can diagnose heart disease, we can identify fractures, organ dysfunction, neurological disease, and hundreds of other conditions. And that information can be life-saving. But there is another side to diagnosis that I think we need to talk about. So sometimes the diagnosis becomes so powerful that the name of the disease becomes bigger than the person. Someone may walk into a doctor's office feeling like themselves and walk out an hour later thinking, I'm a cancer patient, I have Parkinson's, I have Alzheimer's, I have an autoimmune disease, I have heart failure. And suddenly a diagnostic word can begin to define how the person imagines his or her future. And sometimes the prognosis that accompanies that diagnosis can feel almost like a sentence, a life sentence. You will always have this. This will progressively worsen. This is what you should expect. This is what your future will probably look like. Those statements may sometimes be based on very real medical evidence, and we should never dismiss that. But as a practitioner, I also believe we must be careful about what happens to a human being when hope disappears from the room. TCM uses a different kind of language. One thing that I have come to appreciate deeply as I study Chinese medicine is that diagnosis often sounds completely different. Instead of simply naming a disease, we describe what the body appears to be doing. A TCM practitioner might say, there's liver qi stagnation, there's spleen qi deficiency, your blood is deficient, kidney yang is weak, dampness is accumulating, qi and blood are not moving freely. Now, to someone who has never studied Chinese medicine, these phrases may sound strange, but listen to the difference in the language. We're not necessarily saying that this is what you are. We're saying this is a pattern we're seeing. That is very different, because a pattern naturally leads to the next question. What can I do about it? If something is deficient, we can strengthen it. If something is stagnant, we can move it. If there is too much heat, we can cool it. If there's an excess cold, we can warm it. If something is depleted, we nourish it. If dampness accumulates, we can improve the body's ability to transform and move fluids. Diagnosis itself begins to suggest a direction for treatment. And I find that incredibly beautiful and empowering. The diagnosis becomes rather a map This is one of the things that has impacted me most. In Chinese medicine, the diagnosis can become more like a map than a sentence. It says, this is where we are. And then it asks, how do we begin moving forward towards greater balance? That is very much what I mean when I talk about true medicine. True medicine does not ignore symptoms. It does not ignore laboratory findings. It does not ignore serious disease. But it refuses to stop asking the questions simply because someone has been given a diagnostic label. Instead, we continue looking. What happens before this? What system has been struggling first? What is depleted? What is stagnant? What is underfunctioning? What's overfunctioning? What has been happening with digestion? What has been happening with sleep? What has been happening emotionally? What changed after your illness? What changed after a trauma? What changed after years of stress? What is the person's constitution? What is their energy like? What does their tongue look like? Yeah, that's a big one. And then what does their pulse feel like? What is it telling us? You begin to realize that the body has been speaking and telling a story all along. Symptoms are branches. Let's use something as common as headaches. In conventional thinking, a headache is a headache. But you may be given something to reduce the pain, and sometimes that's exactly what's needed, but Chinese medicine asks, what kind of headache is it? Where is it? Is it throbbing? Is it sharp? Is it dull? Does pressure make it better? Does pressure make it worse? Does it happen around menstruation? Does it happen around stress? Does it come when you're with dizziness? Does it come with digestive problems? Are you exhausted when it happens? Are you hot? Are you cold? Because in TCM, several people can all have headaches while having completely different underlying patterns. The headache is the Biao, the branch. But one person's Ben, the root, may involve stagnation. Another person's may involve deficiency. Another may involve heat. Another may involve dampness or phlegm. Some branches, different roots. And if the roots are different, then it makes sense that the treatment should not automatically be identical. Now, this is the same with fatigue. Suppose 3 people walk in the door and say, I'm exhausted. They all have fatigue. That is the branch. But one person is exhausted and cold. Another is exhausted with poor digestion and bloating. And another person is exhausted but cannot sleep, feels wired, irritable, and tense. Those are not necessarily the same patterns. If I only treat the word fatigue, I may miss the person that's standing right in front of me. But if I ask why this person is fatigued, then I begin to look for the root. And that is one of the greatest lessons Oriental medicine continues to teach me. Never lose the person inside the diagnosis. So what is your body trying to tell you? This has also changed the way I think about symptoms. Most of us have been conditioned to think, I have a symptom, how do I make it stop? And again, sometimes the symptom absolutely needs to be relieved. If a person is suffering, we want to help relieve suffering. But Ben and Biao teaches us to ask another question alongside that one. Why did my body need to produce this symptom? What information might be contained in it? Perhaps the body has been compensating for years. Perhaps it has been asking for rest. Perhaps digestion has gradually weakened. Perhaps there has been chronic stress. Perhaps circulation has been impaired. Perhaps the body is no longer adapting adequately and nourishing a particular system. Perhaps there are several layers involved. The symptom does not always tell us exactly what the cause is, but it gives us a clue. It is part of the body's language. Sometimes we treat the branch first. Another misconception is that the root cause medicine means you should ignore symptoms. Absolutely not. If a patient is in a severe pain, vomiting, unable to sleep, struggling with intense symptoms, or experiencing something medically urgent, the branch matters. Sometimes we treat the Biao first. But we help relieve the immediate suffering, but then we do not stop there. We continue asking, why did this happen? Because if we only continue trimming the damaged leaves without ever looking beneath the soil, we may be surprised when the same leaves keep returning. True medicine asks us to do both when appropriate. Help the branch, investigate the root. So what am I learning through my acupuncture studies? As I continue my training to become an acupuncturist and Oriental medicine practitioner, I'm realizing that Chinese medicine has given me language for something I have believed for many years. The body is interconnected. Symptoms rarely exist completely by themselves. Digestion affects energy, sleep affects pain, emotions affect physiology, circulation affects tissue health, stress changes the body, trauma changes the nervous system. What happens in one area can influence another. Chinese medicine has spent thousands of years observing these relationships, and I find myself more and more fascinated by a system of medicine that says, tell me the whole story. Not just, when did this symptom begin, but what was happening before it began. How do you sleep? How do you digest? Are you thirsty? Do you crave hot or cold drinks? Are you more comfortable in heat or cold? What time do you wake up? What emotions do you have? What does the pulse feel like, and what does your tongue look like? In Chinese medicine, these relate to patterns, a medicine of relationship, a medicine of observation. And increasingly, I see why this is such an important part of what I call true medicine. So for me, this may be a great lesson in Ben and Biao, because a diagnosis should give us useful information. It should help us decide, what do we do next? Not simply, what unfortunate thing should this person now expect? That does not mean that we make false promises. It does not mean that every condition can be reversed. It does not mean abandoning good conventional medical care. There are circumstances when medication, surgery, emergency care, oncology, cardiology, and other medical specialties are essential. But true medicine should never require us to deny reality. But neither should reality require us to abandon possibility. Even when a disease cannot be completely reversed, we can still ask, can sleep be improved? Can pain improve? Can digestion improve? Can strength improve? Can energy improve? Can mobility improve? Can anxiety decrease? Can the nervous system become more regulated? Can someone's quality of life improve? What can we support? What can we strengthen? And what can we change? There is enormous difference between creating false hope and refusing to give up the possibility of improvement. You are more than your diagnosis. If you could teach patients one thing from this concept, it would be this: you are not your diagnosis. A diagnosis may describe something important that happened in your body, but it is not the whole story of who you are. It does not tell you everything about your constitution. It does not tell you your own strengths. It does not tell me every system that is still functioning beautifully. It does not tell me how your body may respond to better nourishment, better sleep, appropriate movement, acupuncture, herbs, stress reduction, or other supportive care. It tells us something, and then we keep listening. That is the beauty of Ben and Biao. Remember the tree. So when you hear me talk about the root and the branch, just remember the tree. The symptoms are the leaves and the branches that we can see. But underneath, there is a root system. Sometimes the roots need more water. Sometimes they need more nourishment. Sometimes something is blocking them. And sometimes they have been under stress for a very long time. You cannot fully understand the tree simply by staring at one leaf. You cannot fully understand a human being simply by staring at one symptom or one diagnosis code. That is why, as the founder of True Medicine, and now as a student of acupuncture and Oriental medicine, I am becoming even more convinced that good medicine must remain curious. We should ask not only what disease is this, but what happened here. What pattern is the body showing us? What is the root and what are the branches? And most importantly, what can we do with this information to create the best possible path forward? And that, to me, is the beauty of Ben and Biao. The diagnosis is not meant to take away hope. It is meant to give us information. And information, when understood well, gives us direction. That the symptom may be the branch, but true medicine keeps searching for the root. Remember, you were designed to heal. Trust the blueprint.